Our presentation today is on osteoporosis in older adults. There are many types of bone diseases that affect older adults. Of these, osteoporosis is the most common. Osteoporosis is a progressive disorder that is defined by loss of bone mass and bone density, which then leads to an increased risk for bone fractures. After you reach your mid-30s, you begin to slowly lose your bone mass. This affects women faster than men, especially after menopause. While osteoporosis primarily affects the aging population, it is not considered to be a natural part of the aging process. Each year, nearly 1.5 million people are affected. Osteoporosis is diagnosed with a bone mass density 2.5 or more standard deviations below healthy values as determined via a bone density test. Having osteoporosis can be very costly, not only in terms of money, but also in terms of quality of life and time spent. According to the Surgeon General's report, bone fractures from osteoporosis cost Americans $1.8 billion each year. This is including hospital visits, trips to the emergency room, visits to the doctor's office, and unfortunately for many, a placement in a nursing home. Osteoporosis is known as the silent disorder because it comes without warning. Most people don't even realize that they have weak bones until after they break or fracture one. A bone density test is the most effective measure of bone health and is recommended for all women over the age of 65. Since there are no warning signs, it is very important to practice healthy lifestyle and nutrition habits in order to maximize your bone health as a preventative measure and not just as damage control after the fact. There are several risk factors that you can and cannot control for bone health. Risk factors that are out of your control will be age, gender, ethnicity, and family history. Your risks of developing osteoporosis will increase with age. Women are 4 times more likely to develop osteoporosis than men due to faster loss of bone density due to hormonal changes after menopause. Caucasian and Asian ethnicities are at a higher risk for developing osteoporosis. Furthermore, if you have any history of osteoporosis or bone fractures in your immediate family or close family, please consider having a bone density test done as you will be at a higher risk. Fortunately, many of the other risk factors are well within your control. By taking a proactive approach of eating healthy and adopting healthy lifestyle habits, you can help reduce your risk. Better nutritional status is linked to better health outcomes, not only in terms of bone health, but also in terms of other preventable diseases. As we age, our daily nutritional requirements will change as well. This is especially important for women who will need to increase calcium intake after menopause due to hormonal changes and a loss of estrogen. The daily recommended intake for vitamin D and calcium also increases with age. Please take these new recommendations into consideration, especially when reading nutritional labels, as the RDA for older adults will exceed 100%. When choosing a supplement, please consider factors such as any other medications you may be taking or any health conditions you may have. Calcium supplements come in calcium citrate and calcium carbonate forms. While calcium carbonate is cheaper, some people produce less stomach acid or take a medication that suppresses acid production. Even though it's a little bit more expensive, calcium citrate may be a better option as it is easier to digest. When it comes to bone health, the most commonly talked about nutrients are calcium and vitamin D. Vitamin D levels directly affects calcium absorption, so please speak with a healthcare professional if you are at risk for vitamin D deficiency or know that you have low vitamin D. As always, please consult your doctor before beginning any new supplements, even if they are available over the counter. In some cases, excessive quantities of a vitamin or a mineral may actually have a negative effect on bone health or may interact with any prescription medications you are already taking. Trace elements such as zinc, copper, fluorine, manganese, magnesium, iron, and boron may also indirectly have an influence on your bone health. Magnesium deficiency can impair bone mineralization and may increase the risk of osteoporosis. Boron may influence the metabolism of the other elements above and may have a positive effect on estrogen. There are also many medical conditions and medications that may increase your risk for weak bones. Looking through this checklist for medical conditions and medications, if you have any of the following medical conditions or take any one or more of the following medications, you could be at a higher risk for weak bones. Please speak with your doctor, nurse, pharmacist, or other healthcare professional. If you have not already done so, you may want to take a bone density test as well. A bone density test uses X-ray or sound waves to measure your bone strength. A bone density test is quick, only takes about 5 to 10 minutes. It's safe and painless. All women over the age of 65 should have a bone density test conducted. Women who are younger than 65 and at a high risk for fractures should also have a bone density test. If you said yes to any of the red flags above, you should also consider having a bone density test done. And now for some additional resources. The National Institute of Health's Osteoporosis and Related Bone Diseases Center is located just outside of Baltimore in Bethesda, Maryland. There's a toll-free number you can reach them at, as well as an email address, and their website is listed here. And there's also the National Osteoporosis Foundation, and their website is listed below.